Hi, welcome to Bowie Business Journal, brought to you by the Greater Bowie Chamber of Commerce. I'm your co-host this evening. I'm Diane Palangan with Total Tax Service, and my guest tonight is Dr. Suzette Ettienne. Welcome, and thank you so much for coming out. We have so much to cover in such a short period of time.
Thank you for having me.
One of the things before I have you talk to me a little bit about your background is I love your office. It's set up like a park. It's very relaxing, and books for the children to read, places to sit. I'm sure it really helps take some of that stress and strain off of them, because I remember when I was a child, there was nothing worse than going to the doctor.
Yes, that's true.
And you know, what doesn't hurt you now as an adult hurt you a lot when you were a child.
That's true.
Can you tell me a little bit about your academic background?
Sure. A graduate of Howard University Medical School. I did my residency at Rutgers, Robert Wood Johnson, and then came back to Maryland. I have a degree also from Johns Hopkins, Business of Medicine, and I've been in this area for close to about 24, 25 years, practicing in this area.
So basically you're a brain with legs.
Yes.
So what I'd like to ask you a little bit about is a wellness visit, the thing that scares children half to death because of the needles and the stethoscope and all the things that are just frightening to them that they don't see. Can you explain what goes on?
Sure. The wellness visit, the part of it is what kids are anxious about the vaccinations. It's just a small part of the actual visit. It's basically, making sure developmentally the children are developing adequately, and also that growing appetite-wise.
What is an APGAR score?
An APGAR score is a score given to newborn babies when they are delivered. It's basically to make sure that they have transitioned well from the womb. So it's like 5 different things we look at. We look at respiration or breathing. We look at activity. We look at the color of the baby. We look at muscle tone. Those are some of the things, and we score them. And the score tells us if the baby has transitioned well, or if we need to intervene, whether through resuscitation of some sort. So that gives us a better idea of how the baby has done through the birth.
So when a baby is born, when the gynecologist is there and the nurse and all, you have to have a pediatrician on board right away, huh?
Yes, you do, or a nurse practitioner, someone who's trained in helping to resuscitate the baby and to make sure everything has gone well.
So it starts from the
very
get-go.
From the very get-go.
So when you take blood from a child, that's really traumatic.
It can be.
How do you deal with doing this on a daily basis?
Well, we have well-trained staff, including myself. We try to make them comfortable. We offer them bribes, be it stickers for the ones who are aware, be it different trinkets, and we reassure them. We ask the parent to sit with them, and the things we do to distract them. We also promise them it's going to be short. And kids, everybody has a different pain threshold. So, throughout the process, we encourage them. And there are things that we do have in our practice, things like shot blockers, so the vaccinations and the shots won't be as painful. That's something we introduced recently.
I like that you offer them stickers, because the first thing I thought you were going to say is you offer them suckers. So we'll talk about that when we talk about healthy food. But, part of our obesity is that we offer our children food rewards for, if you do this or if you behave well, I'll give this instead of, who would have thought of a sticker? Certainly not me. Now, allergies seem to be a growing thing for children in more ways than one. I mean, they grow into them, they grow out of them, but it seems to be more allergies and seasonal allergies as well. Can you explain a little bit about allergies and what's the difference between an allergy and a cold?
Well, that's a good question.
How would you tell the difference?
Well, in some ways, they're very similar. So when you think about allergies, it's usually sudden onset. Suddenly you may have a runny nose, scratchy, watery eyes, scratchy throat, a cough. Cold is usually gradual. So some of the similarities are they both can have runny nose or congestion. Usually though with the allergy, the runny nose is more thin, clear, whereas the cold it's thicker. You may or may not have a cough. With a cold you usually feel you may have some body aches and some tiredness. With allergies, typically not. You may have a fever with a cold as opposed to an allergy. But you know, those are the things, and usually a cold is limited 7 to 10 days, whereas an allergy can be prolonged depending on how, you know, what you're exposed to, if it's seasonal. And those are the main differences. They're common things kids do come in for, and it can be tricky sometimes to distinguish. But there are medications out there that will help those symptoms. For colds, usually recommend things like, you know, warm liquids. Chicken noodle soup is actually pretty good for a cold. If they have a low-grade fever, you have a high fever.
Jewish penicillin.
That's right.
Yes,
that's right.
But why is it good for the cold?
It's good for the cold because basically, you know, it's warm. They found out like the electrolytes, the salt in there helps with the mucus, and it's just, I guess as you said, Jewish penicillin, something else in there that really helps.
Makes you feel good.
Makes you feel better.
Yeah. Wow. So there's so much, when we talk about allergies, there's so much that goes with that. It seems to me peanut allergies seem to be on the rise. Some people are so allergic to them they can't be in the same room.
That's correct.
Do you have any light to shine on us? Because as a new parent, you know, one of the exciting things to do is to say, oh, I gave my baby a peanut butter sandwich today.
Right.
And we like to look at them go, you know, working it out. And yet that could be very dangerous. So at what age, with the allergens in peanuts, at what age would you think you would introduce peanut butter to a baby?
Well, that's a very interesting question because previously over the years, yes, it was avoid peanuts until later. Recent studies have shown that the earlier we introduce it, the less likely the risk, but it needs to be controlled. So now, recently, in the past year or so, there are now sources that say as early as 6 months, but it has to be carefully monitored and managed. That's what, it's small amounts because by then the immune system isn't as hyperactive to cause a response. So that's actually pretty new. But yes, and you know, because of so many significant peanut allergies, like any allergy, peanuts as a food allergy, oftentimes we see other sorts of allergies in patients. We mentioned things like allergic rhinitis, like dermatitis, like eczema. Those are other forms of allergies. So yes, we do see, and we are seeing, I should say, an increase in the number of, you know, children having these symptoms, most than before. And there's a lot of, you know, several reasons. It's because of different things that are exposed to. But that's interesting what's happening.
You said eczema, you know, that little ad with the little girl who says, does it work on the face of a fairy princess? What causes eczema?
Well, for many people, it's usually their family history. So it's a hyperactive immune response.
It's not is or isn't an autoimmune disease?
It's not typical an autoimmune disease, that's correct.
Okay.
So it's usually where your immune system is hyperactive to some type of stimulant.
And that means?
That means, you know, it could be a food. Some people, eczema,
hyperactive to it.
Hyperactive or an exaggerated response to some type of quote-unquote allergen, right? So in some people, it could be a particular food you've eaten that may cause this outbreak. However, we do see it in newborns and infants. Now, I wouldn't say newborns, in infancy. And that usually, what questions we will ask is there a family history of anybody with eczema? So there is a genetic component to it. And usually there's a family history of asthma or allergic rhinitis. We see it more. So that person's immune system is very hyperactive. And sometimes we may not find a cause for the eczema. So the immune system is hyperactive to them.
And that would be the same with psoriasis?
That could be the same with psoriasis.
You know, it must be difficult for a child walking around with. Do children get plaque psoriasis?
They do, but usually not something we see. It's not as common as eczema or allergies, but they can.
Yeah.
Usually at an older age, oh, definitely, yes.
They can scratch at that eczema until they're just in the bone.
Yes, it can make them very uncomfortable. That's why it's important to address it and to see how we can, decrease the flare-ups or the different, how it flares up at different times.
But as we talk about the things that food does to us, it brings me to talking about healthy eating, and I do want to talk about healthy eating and what is good for the children to have, but I also want to talk about the difference between the organic food and the non-organic food that we buy, and do we need to be buying organic food? Is there no hormones in it? I guess there's just so much stuff in what we buy. Well,
there is a lot of stuff, as you said, in what we buy, organic versus non-organic, and what that actually means. So food could be organic if, some of the ingredients are organic, not with pesticides or homicides. But the cost of organic is oftentimes what prohibits people from. It's usually much more expensive than non-organic. And depending on what it is, the benefit of it may or may not, outweigh, determine the cost of it. So organic, again, depending on what part of it is organic. So because I've been told that you may plant in a field that is, let's say, corn. It may be planted in the field, or the process is organic, but the field itself may have had non-organic products. So I think, and what I know, it depends on what percentage. So it's not 100, it may not be 100% organic. Let's say if it's 80% organic, we can call it organic. So our foods, there are some, some cross reaction or cross reactivity with those foods. What I try to focus more on healthy eating is the types of foods that we eat, like vegetables and fruit. The fresher they are, the better. If you can get fresh fruits and vegetables, should be a main part of your diet. Less snacking on unhealthy snacks, like sweets and chips, things like that. Less eating fast foods, because we know those are usually have high in fat, high in salt, a lot of additives. And also part of healthy eating is, which people already think about, is a family meal, as a family eating together. That is something we're seeing less and less of.
I know, that's
and it has so many benefits in that when families eat together, they tend to eat healthier. When mom or dad, whoever's preparing the meal, gets the others involved, that's a way of forming a bond, communication, sitting at the table and discussing what has happened throughout the day. Parents being role models as far as healthy eating, so that their kids will be, can see them eating healthy and make that same decision. You mentioned something about rewards, not using food as a reward. The other way said you can reward. So those are things I try to focus more on, what types of foods, when you eat, and also, of course, portion control, things like that, and of course, physical activity. That's another key piece that, because whatever you eat, the food is energy and it's fuel for you to move.
And the kids aren't moving.
And kids aren't moving as much. So yes, we're seeing where healthy eating and portion sizes are a challenge, is more challenging these days.
Now, all the food has portion size on the packaging. I say, for what, a mouse? I mean, something might be a portion is a quarter of a cup, and I think, who are they kidding?
Right.
But those are adult portions. So how do you know what's too much for a child if they're still eating? I mean, do children still get that I'm full signal from the brain to the stomach? Does it take longer? Is that why they're overeating?
Well, the thing about it is that children, especially the younger ones, when they're able, well, we're not talking infancy, but let's say toddlers and preschoolers, a parent would come in and say, oh, he's such a picky eater. And I would ask questions like, well, does he eat a wide variety of foods? Yes, he ate very well, 2 days ago, now the next day, not as much. And I said, children understand their cues. They tend to eat when they're hungry, and they stop eating when they're full. I think as parents, we say, make sure you eat everything on your plate.
Right.
And that is forcing them to eat beyond what their needs are.
Well, you know, I remember too when my mother used to watch my children when I went to work, and my daughter had hurt herself, and I was just coming home from work when she, I don't know, ran into a door or something. And so my mother had her on her lap, and she's, you know, stroking her and saying, "Don't cry," and she was giving her a cookie, and I almost lost my mind. I said, "Mom, she'll grow up thinking that every time she's sad, she needs to eat."
That's correct.
Because I know you can always tell how stressed I am by what size I'm wearing. Because I'm an eater, I'm a stress eater.
Right.
Now, my oldest daughter is also a stress eater. My younger daughter, I think it's un-American. She doesn't eat if she's stressed. She can't. And I say, nobody real does that. But so you can tell how stressed she is by how thin she is. So food is a big thing. So you're able to give dietary measures to the parents when they come in?
Yes, we do at the well visits, dietary measures. The other thing we look to at very key in pediatrics is our growth charts. So you can tell if that child is growing adequately. So when they come in, we do the vital signs. We check their height, their weight, if they're under 3, their head circumference. And how they plot along their growth chart tells us whether nutritional wise, at least they're growing adequately. That's key. So again, that's another tool that we can use to see if it's too rapid growth, not enough growth. Very vital tool that we use, especially for, like, you know, when you can't quantify how much they're taking. For example, a breastfeeding baby.
Right.
Or you know, an infant on formula, or, you know, first stage, second stage foods. You know, babies are different.
Yeah.
We all come in different shapes and sizes. So for that particular patient, that particular child, following their growth chart is key or tantamount for us to know if nutritional wise they're getting enough calories to grow adequately. And then based on that, we can make suggestions as far as if we see any concerns.
Well, sometimes they get to be real picky eaters. We have so much to cover in this period of time. Vaccinations. There are a lot now. When I was very young, polio was introduced, and then if there was a side effect from polio, I had it. As a matter of fact, I would venture to say I probably had a mild case of polio because I was so sick, and the fever, and I couldn't breathe, and I couldn't walk, and there was all kinds of things. And my parents were terrified to give us this polio shot, but they did because it was scarier to get polio than it would be to get the shot.
Right.
We lived in Brooklyn when the shot came out, Brooklyn, New York, and they used to open the fire hydrants to drain them and release the pressure, I guess. And everybody would jump in the fire hydrants to cool off, but we weren't allowed to because they really thought that's where polio came from. So what about the various immunizations that children have to have?
So you're right. Over the years, they have increased. There are about 16 different vaccinations. So within the first 2 years of a child's life, and of course some are repeated. There's a series. They come in series. So in the first 2 years, they'll be getting up to 29 vaccinations. It sounds like a lot, and I think that's probably too why some parents are apprehensive, because all these shots, you know, isn't necessary. But based on the science, what we have known, this is the schedule that has been deemed to be adequate to provide the, you know, protection from these different diseases. Wow. The apprehension too is that could these vaccines cause the disease? So
yes, I was going to ask you about that.
So the whole thing about vaccination, which my personal thing is a cornerstone of pediatrics. That's what we do very well. You know, prevention is better than cure. They're preventative. So there are basically, you know, 4 types of vaccines. Some may be live, which is a weakened state of the particular illness we're protecting against.
Which is why people think you'll get the disease.
Which is why they think you get the disease. There's some that are killed. There's some toxoids, which is basically a chemical similar to the, you know, a protein, of that particular bacteria, and then the man-made ones like the hepatitis B. But the whole thing is designed so that when your body sees a small dose that we give in the vaccination, it mounts an appropriate immune response. So your immune system needs to be strong and intact to mount a response. And that's how the body, if it sees the actual illness, I remember this, and can then provide a protective response to the actual disease.
So there is really no connection between autism and the
MMR.
immunizations.
Correct. So when this first started was, I think in 1998, there was a publication in the British Journal, The Lancet, about the possibility with MMR causing autism. From that time to now, it has been refuted, but urban legends continue.
Yes.
But
yes.
part of the reason too was that the MMR, which is the measles, mumps, rubella vaccine, is typically given between 12 to 15 months. And autism, which is a social
Shows
condition.
Up around then.
Well, the symptoms, my child's not communicating, not making eye contact, flapping arms, at 15 to 18 months. So you would think that, this happened after he got the vaccine because it's so close proximity.
Yeah.
But many, many studies in America and Europe have shown that this is not true, and there's still ongoing studies. But autism, we think there's a genetic component, because you can see symptoms earlier, and so yes, but it's very difficult because of the media, because of people's differing opinions. I think there have been several celebrities who have attributed vaccination to their particular cases.
Yes.
That's become very popular. That is a challenge why people still believe that it does cause autism.
Well, I believe that everybody should be immunized. I had a cousin who died from diphtheria because we did not have the DPT shot then.
Right.
And so I just don't understand why people don't want to. If you don't immunize, then that disease comes back. And it's very difficult to try to make people understand that.
Well, there are certain circumstances when we would not want to immunize if that particular patient's immunocompromised.
Yeah.
There's some people with religious beliefs or certain philosophy, but we try in our practice to educate as much as we can to reassure parents and give them the right information so they can make an informed decision. Now the schools, especially daycares and schools, are making it mandatory for at least the regular series of vaccinations. But it's oftentimes a topic where we have much discussion on those who have questions or who may be a little apprehensive as far as their child getting vaccinations.
Yeah, it is a scary thing. I know when my children were little, they stopped giving the smallpox vaccination. Right. And I wanted them to have it because I was so afraid, but they wouldn't give it to me because they said, it's just, we don't even have it. It's just, you don't need it. I'm thinking,
right, it's eradicated.
Suppose somebody comes into this country with smallpox. But, so I guess you have both ends of the spectrum. One who goes crazy because they can't have it.
Right.
One who goes crazy because they have to have it.
Right.
So we're probably running down on time here, so I want to ask you about some trends. What's happening now? And any concerns or trends you'd like to?
Well, there are a lot of trends. I think one of the major ones, social media. When I say social media, especially to the younger population, infants, toddlers, recommendations are they should have no screen time. That means tablets, iPhones.
None.
None.
And why
under
is that?
18 months. Because what we found out is that during that time, developmentally, it doesn't add any benefit. It actually can cause delays in language skills, poor social interaction. Really? It may even affect, their sleep patterns.
And yet they're trying to sell books to young children to teach them to read before they're a year old. And
right.
That's, is it the flashing of the screen?
Well, the way our brain works, and we are social animals, talking to your child, reading actual books, they get the context when a person is doing it. When a screen is doing it, you don't have the right context. Their brains haven't developed that advanced to understand, this means this. So that's why you want to limit. I know we don't live in a perfect world, but limit screen time. Spend more time engaging with your child. Give them things like, for example, you're cooking, you're making dinner. You say, it's just a distraction. They watch the TV for half an hour while I'm making dinner. That's a good option. Well, it's a better option than I guess, them, getting into trouble. But it's a better option if they're in that kitchen with you banging pots and pans. And you looking at them and saying, Johnny, stop, or Susie, stop doing that. Because then they understand, this is Mommy's saying no because, or Daddy's saying no because it's a reason behind it. They understand the context of it. So the American Academy of Pediatrics and studies have shown that, not before 18 months. And then after that, now they have the skills and tools to now put that information from a screen into context. And even then, it's recommended probably no more than 1 hour a day.
I think they spend too much time on it anyhow. I do need to ask you about your community service. I understand you're really involved.
So yes, over the years, we try to do at least a couple events to go into the community. The most recent one we did was a walkathon. And then we sometimes go to the school. I do presentations there. And then we also, donate to local, whether it's churches or the food pantry. So yes, like the, book fairs or back to school events, fundraisers, we do that. Because I think it's important that if you are in the community to be a part of the community.
Yeah.
It's not just staying in my office, those four walls, but going out and seeing, how we can interact and how we can, the needs of our community and to give back.
Yeah, I still want to get back on this social media and the screen time because, I see very young children with the iPads and everything else, and they seem to spend so much time that they're not exercising. But I wonder what it's doing to their eyes because they all hold it right up here.
Right. So
it's a no-no. But at this point in time, as much as I'd love to keep talking, we are out of time.
Wow.
Wow, I know it. It's been such a pleasure talking to you. I hope you all enjoyed the show as much as I have enjoyed it because this has been an eye-opening experience. Thank you so very much.
Thank you so much.
And welcome to Bowie after 20 years. I finally get to meet you.
Thank you. Nice meeting you too.
Great.
All right.